Mr. President, what an honor to be here today in this office to announce a landmark agreement. So it's an historic day because I think today we are turning the tide and we are reversing an unfair situation. For years, other rich nations refused to pay the fair share for the medical innovation. And as a result, Americans had to assume disproportional cost on their shoulders. With this deal that we signed today, we satisfied all 4 of President's requests, all 4. By this agreement that we did, we commit to onshore the production of our medicines that are consumed in the US and are made outside the US. And for that, we are ready to unleash our investment portfolio in this country. And the President graciously gave us a 3-year grace period that we will not be subject to the 232 tariffs, as long as, of course, we move the products here. I really think this is an historical moment because also I can put that behind us and focus on the things that I want to spend my time, cancer treatments, to bring better obesity medicines, to bring better vaccines, to bring things that people value. And thank you for allowing us to do that. Mr. President, I want to thank you.
Thank you very much.
For your leadership and, frankly, for your friendship.
Thank you.
Thank you.
Albert, thank you very much. Great job. Great job.
Even all of the negotiators here and all the people on at HHS and at the White House team, all we could see was all the reasons that this couldn't happen. Everybody had tried. Nobody could make it happen. And it was President Trump alone who, with his doggedness, his persistence, he saw this clearly in a way that none of us other, in its most simplest terms. Why are we spending more on this country than any other country? Why are we spending 75% of the revenues that come to the pharmaceutical industry? We're doing all the research and everybody else is riding on our slipstream. We refuse to make the most vulnerable citizens continue to pay an unthinkable price for the world's pharmaceutical breakthroughs, which we pay for. This policy is a shield for the chronically ill who have carried the burden of high drug costs for far too long. It's a signal to every American family that we're finally putting their health and financial security first. And it sets a new standard, one that says we won't write blank checks to the drug industry any longer. No family should ever be forced to choose between filling a prescription and putting food on the table. Americans should not be gouged paying 300 or 400 or 1,000% more than people in other countries for the exact same drug, many times manufactured in the same factory in New Jersey and sold in Great Britain for 1/10 the price that it's being sold for here.